Hi, I'm Dr. Brown. So there is a large misconception out there about what a hymen is in a vulva owner's body. Many people think that the hymen is a thin bit of tissue that sits right in front of the vagina and that it breaks or ruptures whenever sex happens for the first time. This is actually not true. So the hymen in most women, of course there's some variations as there always is in medicine, looks something like a hair scrunchie. So it's really stretchy and it can stretch to fit tampons, penises, objects, things like that. And in most women, the hymen is open from the time that you're born. So there is no such thing as a thin film. Nothing gets popped or broken. Yes, there are some women that are born with congenital anomalies called imperforate hymens or microperforate hymens that do have that covering. That is atypical, and most of those women are going to need to have some sort of minor surgery later on in adolescence to fix that so they can actually have a period. The other thing is that the hymen, unlike a hair scrunchie, is made of the same tissue that you find inside your mouth. So imagine that you're chewing some delicious food, you bite, you hurt the side of your mouth, it gets swollen, it might even bleed, and then a couple of days later, you're chewing again and you feel the side of your mouth totally gone. It's completely healed and you can't tell that you injured yourself anymore. This is the same thing as hymenal tissue. In fact, that's the same thing as the tissue in your vulva in general. So after having sex or after a sexual assault, if there is injury there, it will likely heal within a couple of days. And then after that, it's going to look the same as it did before. So there is no such thing as virginity testing, and there is no such thing as a little piece of tissue that tells anybody what your sexual status is. You need to bust this myth because it is hurtful to women. The other thing to know is that many women think that the first time you have sex, it absolutely will bleed. It will not. 50% of women do, 50% of women don't. It doesn't necessarily mean that the hymen got injured. There's lots of different areas of the vulva that can get injured, but typically that's because of technique and relaxation. So I hope that helps.